Hello, everyone, and welcome to the Your Mark on the World show. I'm your host, Devin Thorpe. We're producing this episode for GoodCrowd.info, and our guest today is Derek Fetzer, the director of CaringCrowd at Johnson & Johnson. Derek, welcome to the show.
Thank you. It's great to be here.
We're thrilled to have you, and thank you very much for taking the time today. We're excited to learn more about CaringCrowd. It's a crowdfunding platform for global public health projects and efforts. Funded by Johnson & Johnson. Very, very exciting. So, Derek, give us a little overview of how the platform's working.
Sure. Basically what it is, it's a crowdfunding platform. Well, before I continue, I need to say that all opinions expressed are my own. I work for a very large company and there are rules. So
Perfect.
That's moving forward. So basically, CaringCrowd is a crowdfunding platform for global public health. It's 100% dedicated. It's an all or nothing type arrangement, very similar to Kickstarter. I think the differences are that we don't charge for the platform for 501c3s using the platform for public health projects. And also very important because we are talking about health, and health is a serious issue. So we do have a panel of experts of people coming from Harvard, Princeton, Johns Hopkins, Northwestern, et cetera, that look at the projects and make sure that they're in line with the definition of public health, right? So that's very important. It's not just not throwing a project out there. The projects have been looked at by experts. So that's an important distinction. And then we do this as we do this because we are a healthcare company. We're very much engaged with health, and so this is just a great way that we can engage and help out some of the larger problems in the world.
So, Derek, I want to kind of get at examples and what's typical. Tell us a little bit about what you're seeing on the platform in these early days.
Sure. Well, we're looking at smaller projects, and so they can be as small as $1,000. The biggest project that we've seen is $30,000. So these are sizable projects, but I think what's important to note is that while they might sound monetarily quite low, these projects go very far in parts of Africa, Latin America, and Asia. They can reach thousands of people for for what we would view as a minor amount of funds. So while the project sizes might sound small in terms of the monetary aspect of it, but they can have huge impact in terms of the number of people and lives they can affect.
Interesting. I'm imagining a Rotary Club wanting to fund a project to do polio immunizations in Africa or Pakistan, a Lions Club using it to fund measles immunizations in Latin America. Is that kind of project something that would fit?
Absolutely. And we're already seeing that happen, where actually companies are coming forward and just using it, and they don't even have to ask us. They just basically they work with the nonprofit they want to work with. The project gets loaded up on the platform, and then they engage however they might want to engage. So we don't need to actually interact. They can just have that project loaded. A company or an organization could just say, we have this project up. If that happens, we commit to doing something else, right? So it's already happening.
Oh, that's great. What was the $30,000 project?
So that was a great project for to train the first emergency care physicians in Uganda. And so that was phenomenal because I think one thing that was incredible about it was the type of awareness it brought to the situation, that there were no emergency care physicians there, right? Basically, if you had an emergency, you would have to wait for days to find help. So basically, if we're training the first emergency care physicians, they can go on to train others, etc. So any given emergency care physician can affect up to maybe tens of thousands of patients over the courses of their careers. So it is huge.
That really is exciting, and
Yeah.
I'm excited about the platform and how it can be used. Johnson & Johnson is funding the operation, and you say if the money is going to a 501c3, the fundraisers pay no fees. Am I understanding correctly?
That's right. We do not charge for use of the platform. J&J has a huge and incredible IT department. I mean, so not only are they savvy with IT, but they are passionate about health. And so these two come together. They really, our IT department has really bent over backwards to make this work, and make this happen. And so yeah, it's been phenomenal. It's been phenomenal.
Does J&J ever use any of its resources to fund the projects directly?
So not our projects, no, sorry, not projects loaded on CaringCrowd. So there is another area of the company that does look at working with projects directly, but you can understand that there are a lot of people wanting that. So that's more of a rare case when that type of funding happens. I think the nice thing about CaringCrowd is that it democratizes. Basically, you're looking at a panel that reviews the projects, and we allow the project owners and those nonprofits to go out and basically look at their social networks and tap into them and have all the logistics of CaringCrowd work out for them. Again, as you said, free of charge. Now there is a payment processor charge on the side. We use Stripe. So they have their fees, which are small, but it's a small fee that's incurred to the project owner. But aside from that, the vast majority of the funds go directly to the project owner. And again, I'll reiterate that these project owners, these are smaller 501c3s. They're lean. They don't have extensive marketing budgets, right? And so they look at CaringCrowd and they see an opportunity to leverage, right, a crowdfunding platform that's very well staffed and attended to, and use that to get funds for their projects.
Well, it is, I think, a noble effort and exciting for those who work in the public health arena that they now have a new way to get funds cost efficiently. When did you launch the platform?
So the platform launched a little more than a year ago, and at that point it was a pilot. It was a beta year, and I would say that we recently upgraded in the platform. It launched at the Global Citizen Festival in New York City back in late September this year.
Great, and I met you and had an opportunity to visit with you first in October at a crowdfunding conference there, and it's exciting to see the progress you're already making. Where do you see it going from here, Derek?
Oh, that's a great question. So we have high hopes for this, right? We really want to see this take off. I mean, we would love to see, when you look at the crowdfunding today and you see things like, $90,000 to build a hole, right? Just as a joke. $90,000 in many parts of the world could go so far. Imagine if we could hit some of the targets, something like a Kickstarter at $1 billion or an Indiegogo. I mean, those type of volumes, and at those type of at that monetary value, you're talking about tens of millions of lives being impacted by that, if not more, right? So I can see that happening. It's just very exciting. And beyond crowdfunding, I think we can also start looking at how do we evolve into crowdsourcing. And so just beyond the funding aspect of it, start saying, okay, how can people come together? I mean, doctors, lawyers, to make these projects happen, right? So right now it's centered on the funding aspect, which is the key, the cornerstone of everything. But imagine if not only when we launched a project, we could also say, we need this type of technical expertise. We need this. Who might have the best plans to build a water well? Things to this effect.
Well, it is, I think, a platform with great potential. And, if you're able to scale this up over time, the impact of the projects, whether the projects grow or not, almost doesn't matter. If the number of projects grows, the impact that J&J can have with CaringCrowd can be substantial.
Absolutely.
Very exciting to see that. Derek, I want to just take the opportunity while I've got you to ask a couple of more personal questions. You are becoming a role model to a lot of people in the crowdfunding space because of your important altruistic work. Tell us a little bit, if you would, about who you look up to, who inspires you.
Sure. Great question again. Actually, when I think about it, and I go back a couple of years before we even knew about crowdfunding, and I'll just tell a story of the person that I met. And I was in a shanty town in Lima, Peru, and I'm from Lima, by the way. And I was talking to a healthcare volunteer, and she basically, what she would do is carry medication every day to tuberculosis patients throughout her community. And she did this every day, and we're talking about communities that don't have running water, that may or may not have electricity. So very, very basic. And a lot of these shanty towns actually go up the side of a mountain. And so basically imagine that every time you wanted to go to your home, you'd have to walk up 10 flights of stairs or 15, possibly 20 flights of stairs to get to your home, right? Every day. So she would deliver these medications every day. And I asked her, how long have you been doing this? And she said, well, about 20 years. And I was taken aback. I mean, she's a very humble, she's about half my size, about a fourth my weight. So, and I asked her, why are you doing this, right? You don't get paid, you don't, it's a lot of work. And she said, well, 20 years ago, I had tuberculosis. I'm poor, I was alone, and I'm sick. I was scared out of my mind, and I don't want to wish that on anybody in the world. And that's why she did it. And when she said that, I thought, I'm sitting in a company like Johnson & Johnson. What might we do to help out these heroes, these everyday anonymous heroes? And when I thought about it, and as my co-founder John Brennick and myself, we were batting ideas back and forth, and we really came to this idea of crowdfunding and how it could help out this anonymous healthcare volunteer, of which there are millions, and these are our heroes and our inspiration for the platform.
Oh, fantastic. That's a brilliant story. Really inspiring, truly inspiring. And I really love what that means. It's on so many levels in terms of the entrepreneurship that represents, in terms of her passion, in terms of impact and where this all comes from. I really appreciate you sharing that. And I guess that helps to answer the next question I would ask you, which is why you care about all of this. And you alluded to that. Maybe you're from Lima, but perhaps you want to expand on why you care about public health.
I think one is public health it's really thinking about the health of all of us in a more systemic and fashion, right? So it focuses on the prevention. It focuses on populations, whether they be a country level, a city level, a local level, just your family, the individuals. So public health is a great way to think about, how can we best get everybody's health needs, right? And it focuses a lot on prevention, and that's where I see a lot of the projects moving towards in CaringCrowd as well. So why do we care about this? I mean, how can we not care about it? I think, when you hear the story of this elderly lady that goes out and helps the community, how can you not empathize or be compassionate to her cause, right? And I think it's just basic humanity, right? So, think about how she, what she was going through when she was sick, right? Here you and I have been sick before, but we weren't alone, and we had probably had very good doctors attending to us. It was still probably pretty scary.
Yeah, boy, great example. Now, you're doing some real good, and we like to ask all of our guests for an impact hack, some tip that would help us to do more good. What's yours?
Sure. So one thing that I'll say is before that is, we are doing good, and that's the beautiful thing about crowdfunding. It's you, me, and it's everybody together. It's not monolithic. It's what we want it to be, right? And so that's what I love about crowdfunding, is this whole notion of the democratization of funding, and that we're not looking to basically something monolithical to solve our problems. It's us solving our problems. So I just wanted to say that it's really all of us, the project owners, the donors, etc. But if you were asking, sorry, and to get back to your original question, what works? I think was your question, right?
Well, it was, I want a tip that would help us to do more good, an impact hack.
I think the best thing is to really find people that share your vision, right? And that's really important, because you want to get away from this sort of transactional environment, right? Where I want you to do X and you do X, right? But if we're saying, look, I don't know how to do all of this, right? When we started 3 years ago, John Brennick and myself, when we started this expedition on crowdfunding, we didn't know a lot of things. We knew very little about crowdfunding. Nobody in the company knew how to execute on this from a legal point of view or financial, and we worked through it. But to work through it, we sat down and said, this is what we'd like to see happen. We have no idea how to get there. You own a part of that. Help us get there. Help us design that. And they would get excited about that. People get excited about this, and we don't have all the answers. And I love that sort of humility that everybody shares, as I don't know how this is going to work, but certainly we want to see this happen, and we want to have this impact on the world. And so, I'm just really pleased with how the company people have come forward to help out from all areas, like legal, healthcare compliance, finance, how people have come together and just say, I want to see this happen. And in order to make this work, this is what has to happen. And they would design it so that it could work. And because of that, we got this done in record time.
Yeah, I hear you. Well, this is really great insights. And Derek, I really appreciate what I've learned from you today. And I think you're doing great work. Before you go, please tell us how people can learn more about CaringCrowd and connect with you.
Oh, very easy. So go to CaringCrowd.org. That's our website. Feel free to you at the bottom of the page, there's the contacts. So you can find us there. If you wanted to go straight to email, it's help@caringcrowd.org, or you can actually look for me on LinkedIn as well, Derek Fetzer on LinkedIn.
Fantastic. Well, Derek, we really appreciate all the time you've taken with us and wish you every success in scaling up CaringCrowd for good.
Thank you. And I look forward to seeing a lot of the listeners on CaringCrowd. So thank you so much.
All righty. Let's do some good.